Hello, this is Dr. Rama Chandramohan. I am the Deputy CEO of the Center of Excellence for Autism in Chennai. So today we've been called by the India Autism Center to answer a few questions, and these are the common doubts which parents raise over and over again. So the first one is, if my first child had a neurodevelopmental disorder, what's the chance my future or second born child will have it too? So neurodevelopmental disorders are varied and each of them have their own recurrence risks. So if they have a genetic basis like intellectual impairment, that is, if it is an autosomal recessive, then there is a 25% chance that in every pregnancy that child, 25% chance in every pregnancy that this child will have a chance of getting the problem. Or if it is an autosomal dominant based condition, it is 50%. But normally in autism, in a general population, it's around 1 to 2%. If one child, the first child has the problem, then it is about 10 to 20%. And with every second or third child having the same problem, it multiplies. Whenever there is a genetic basis for a neurodevelopmental disorder, then to a certain extent we can predict whether the subsequent child will have it by doing the particular genetic analysis, provided it is a single gene condition. The next question, how can adults with ASD or ADHD manage work, relationships and independence? So this is a little bit of a tricky question because it depends on how much of therapy or how much of improvement they have had in their lives starting from the beginning. So if this child has been diagnosed late, if it is coming under the severe form of the spectrum, then they may have difficulties in getting along with people. But if the same individual has started early in life, has got majority of the behavioral conditions under control, there is no sexual dysphoria, this child has adequate medications when needed, then this child can thrive well in the society, provided the society is supportive of their needs and their quirks. Do vaccines cause autism? So this is a definite no. If a child does not receive adequate vaccines at the appropriate time, there is a greater chance of the child succumbing to these life-threatening infections which can come to the child if the child does not receive vaccines. So none of the vaccines have been proven, especially the MMR has absolutely no role in causing autism, and that is a big myth which should be debunked. Given that autism is a neurotype rather than a disease, how can society better integrate autistic perspectives to benefit from diverse ways of thinking? So this is again a societal role. So the first and foremost is creation of awareness about autism. Know that it's just a diverse way of thinking because the brain is differently wired. Then to accept that these children or these adults are just functioning in a different way. So from awareness to acceptance will then move on to an inclusive society where one sees an autistic person as just a variant of normal, accept them and take them as part of your normal community, give them the chances that they rightfully need and which they rightfully deserve so that they can also function as an ideal person in the society. So with this, I come to the end of this question session, and I'm extremely thankful to the India Autism Center for having me here today. Thank you.